Did you know that not all joint replacements are the same? A lot of times it really depends on what joint we're replacing and what the patient factors are that can influence the outcome of their procedure. Hi, I'm Dr. Algazawi. I'm an orthopedic surgeon with more than 10 years of experience in replacing joints. I have replaced shoulders, knees, hips, and what I've learned is that one of the biggest things that leads to better patient outcomes is informed decision making, talking about what to expect after surgery and selecting the right patient for that joint replacement. Even though we've made a lot of progress in how they're made and the longevity of those implants aren't necessarily lifelong. We used to say that you need a new knee replacement in 15 to 20 years, but those timelines have gone longer as our implants continue to improve. Even a perfect joint replacement surgery requires you as the patient to put in the effort. Mobility takes time. It takes hard work. It takes a lot of therapy to get back to the level of activity that you want to get back to. So I have a lot of patients asking what they can do to reach to a successful outcome. My part, doing the surgery, is only one component of a good clinical outcome. I could do a perfect surgery, but if you as the patient is not putting in the effort, not going to therapy, there is no way you are going to have a good outcome. Physical therapy is a key component to rehab, recovering, and getting back to your activities. Watching in the early post-operative period for complications, we like to catch any complications as far as infection or wound issues early. That gives us a better opportunity to address those potential issues and make sure that we're on the right track. But also following the rehab protocols that we give pretty strictly. There's times where patients feel pretty good and they want to push the envelope, but there are reasons why we set up the rehab guidelines and protocols the way we do. We want to get you through each phase of those guidelines to make sure that we're not stressing things in the wrong way or going to do too much too quickly and then setting you up for failure. One thing that we used to say in orthopedics is that you might need a revision total knee replacement or total hip replacement. As we've become better at making the implants, each generation or iteration of these implants are made with better technology. The old adage that you'll need another hip replacement or joint replacement is starting to not be true. You might actually outlive your joint replacement. There are scenarios where you get a joint replacement at a younger age and these parts and pieces can wear out. In that case, we're potentially just replacing part of the joint replacement, a liner exchange or a poly exchange where we replace the plastic. The technologies that are pushing medicine forward are also helping us put better implants into people's bodies. Even though I am an orthopedic surgeon and surgery is one of my favorite things, I try to guide people explore all their options, especially when it comes to arthritis or potential need for a joint replacement. There are plenty of options out there that we try, conservative approaches, including physical therapy, different kinds of injections, whether hyaluronic acid or a gel injection. There's injections called PRP or platelet-rich plasma that have been showing a lot of benefit for arthritic situations that potentially can delay the need for joint replacement. Weight loss and exercise are also a key component to maintaining joint health. We know that every pound we carry is amplified between 5 and 7 times through our joints, depending on your activity level. So a little bit of weight change can make a big difference as far as joint pain goes. Ultimately, when we fail conservative management options, we exhaust all treatment modalities. That's when you self-select towards the patients that will have a good outcome with joint replacement surgery. Joint replacement should not be taken lightly. It is a major procedure, a major decision. It can completely change your lifestyle. So you make sure you're well informed, make sure you're asking the right questions, and you have to prepare both physically and mentally. What is a little bit of a long road to get back to full recovery? You can schedule a consultation today to discuss your treatment options, including joint replacements. Thanks for watching. I'm Dr. Algazawi, and I'm here to answer your questions and help you get back to hopefully a pain-free lifestyle. Feel free to give us a call at 212-737-3301, like and subscribe, and we'll see you soon.